Good morning. Happy 8 a.m. I hereby call this the first meeting of the House Standing Committee on Families and Children to order. As a reminder, please make sure your cell phones are on silence so it's not we don't get disturbed during the meeting. DJ, will you please call the roll?
Representative Baker. Representative Banta.
Here.
Representative Kleins.
Here.
Representative Decker.
Present.
Representative Dietz. Representative Elliott. Representative Fleming. Representative Gooch. Representative Proctor. Representative Rayburn. Representative Raymond. Representative Rourks. Representative Tate. Representative Wilner. Representative Wilson.
Here.
Vice Chair Riley.
Here.
And Chair Heverin.
Present. Do any members have any comments or recognitions before we get started this morning? No? All right. Committee's already off to a great start. Thank you. I do appreciate laughs every once in a while. This jurisdiction of the task force is published on the LRC website, but I will go over it today. And I really look forward to being the chairman and working with Vice Chair Riley on these issues in the committee. So the Families and Children jurisdiction, matters pertaining to child welfare, adoptions, assistance to children, children's homes, commitment and care of children and families, child protective services, adult protective services, state guardianship, caregiver support services, child support programs, programs of dependence, family preservation programs, social service programs, child care, senior citizens and aging, disabilities, rape crisis centers, domestic violence shelters, sexual assault programs, public assistance programs such as TANF, CCAP, SNAP, and LIHEAP, and WIC. I believe that the new commitment or the new committee, it shows the House majority's commitment to families and children across the Commonwealth of Kentucky. So we are very excited for this opportunity to have the space to be able to talk about these issues. Additionally, all committee meeting materials are posted on the LRC website, so if you need to look at anything, please go on there under our new committee tab. I would like to go ahead and start on the agenda with the overview of the organization and structure for CHFS. I would like to welcome Secretary Friedlander, who will discuss the workings of the Cabinet as it specifically relates to the new jurisdiction of the House Standing Committee on Families and Children. And if each of you all can introduce yourself for the record, we would greatly appreciate it.
Sorry, we're getting ourselves organized. I'm Eric Friedlander. I'm Secretary of the Cabinet for Health and Family Services. Jackie.
Hi, my name is Jackie Richardson. I serve as his Chief of Staff.
Carrie Banahan, Deputy Secretary of the Cabinet.
I'm Eric Lowry. I'm the Budget Director of the Cabinet.
Good morning. Thank you for the opportunity.
Just a reminder really quick, sorry, Secretary. Yes. Please make sure you turn on your microphone when you speak. You'll have a little green button. Yeah, thank you.
Thank you. So I just want to begin by saying how happy I am that this committee exists. With the Cabinet for Health and Family Services, and I'll go through it in more detail as we go through, it's a big cabinet, about $18 billion with a B. But 15 of that is Medicaid. So when the committees are combined, a lot of what happens is Medicaid takes up all the air. And so to get to other issues within the cabinet, and your description of your committee's jurisdiction is obviously still broad, but those issues don't always get aired or have the time to get air when the committees are combined. So I really look forward to the opportunity to talking about some issues that we all need to work on together. I've worked for the cabinet since 1985. There are some people who were not born yet, and I try not to hold it against them. But so long experience. Carrie Banahan began with the cabinet in
1982.
So between us, we have 136 years of experience. Jackie's worked for the cabinet since
Well, the cabinet, state and local government, so it's been a long time since 1980.
And Eric as well. So there's a wealth of experience within the cabinet. Eric, you started Now, he's the youngster here. He's the youngster. I do hold it against him. First slide. I've had the opportunity. So these are the departments in the cabinet. It's a little bit of an eye test, but I hope you have some of the paper in front of you. There are lots of departments in the cabinet. The ones I'm going to present on today, I'm not going to present. I didn't do it. So if you have this in front of you, I can go through it as well. The ones I'm not going to present on today are Medicaid and public health. So again, public health. So for the first time in front of a committee, I don't have to talk about COVID. I'm very excited. These departments should work together. That's what's important. And some of what you all described, Chairman Heverin, the child care, right? The child protective services, the pieces that really don't get covered very much are the adult protective services and guardianship. We rarely get the opportunity to speak about those programs. So it's things like senior meals, which are very important to constituents across the Commonwealth. These are pieces that I get again excited about talking about. So as you can see, and yes, there's a cabinet reorganization bill that's coming through. I've already testified, I think, in terms of what I think works and doesn't in that. But appreciate the opportunity, again, to address overall cabinet issues. So there are also then several pieces that are within the Secretary's office, essentially. And so those things that you would think about, human resources, contracts, procurement, all of that falls within basically the Secretary's office. So just some quick numbers, 1.7, now 2 million people in Kentucky who receive their health care through Medicaid. That's approaching 40% of the state's population. As has been noted by several committees, that is not necessarily a badge of honor, because in order to be eligible for Medicaid, you have to be below 130%, 38% of the poverty level for the most part. So we've got a lot of work to do in living wage and getting folks to a place where they have an income that they no longer need Medicaid to provide health care coverage. But what I'll also say about Medicaid, and get off it very quickly, is that's a lot of money that goes into providers. You don't, as somebody said, you don't get rich off of getting an appendectomy, but it is money that goes to hospitals and nursing homes and physicians, and so that funding does go across a broad spectrum. There are, we see an aging population that is coming, the baby boomers, I am one, who are getting towards in our 60s. Again, I am one of those as well. But that's a population that's going to continue to increase. So issues around dementia, Alzheimer's, how we care for folks in their homes, how we work with people through our Department of Aging and Independent Living to make sure that we're taking care of people where they want to be taken care of. The food assistance piece, over 540,000 folks who receive SNAP benefits across the Commonwealth. And again, I like to say those benefits, while they help individuals get food, the other way to think about that is this is money that goes to grocers. And so grocers, being a small margin business, the SNAP benefit is probably as important to grocers as it is to the folks that receive those benefits. So about 8,600 this slide, but I think we're down to a little over 8,400, somewhere in there. Children who are in out-of-home care, so that means foster care. It means in our facilities, and so that's the number of children. When 3 years ago, there were about 10,000 children in the foster care system. So we've seen some reductions. We hope that's a result of the Family First and some of the prevention work we've been doing. We've been talking about over several years with committees here in the General Assembly. We believe that's has had an impact. Again, keeping kids with families. If you think about, and when I think about myself, if I turned 18 years old and didn't have any family, what a challenge that would be to exist. When I was working for the city of Louisville, what we'd see on the streets is younger people who were homeless, almost all of them had come through our foster care system. Lots of work to do there, and also over a long period of time. But hopefully we're making some progress. We are seeing our abuse and neglect rates go down a little bit. Part of that is a change in the definition that was passed a couple of years ago so that we didn't identify poverty as neglect. So we're seeing some declines. But what we are seeing, if you ask any provider, what we're seeing in our children is much more severe. Again, going back to a couple of years of not having eyes on kids, either in schools or churches or wherever, child care centers, a child that was in a family where there were challenges, we didn't see for a couple of years. So what we're seeing in kids is so much more severe. And many of our providers report that. You can see that that intersection between us and juvenile justice, where some of these kids can go back and forth between systems, but what we are seeing in these children is certainly more acute. Next slide. Sorry, I'll move on, because I really am getting into the Department for Community-Based Services piece. So the cabinet has about 6,000 employees, the majority of whom are employees of the Department for Community-Based Services. We have offices in all 120 counties across the state. Got one that's got I forget, had a little bit of a flood issue. So, but we're in every county in the state. We have worked very hard on trying to get folks to use online tools, use our phone system, rather than come into the office. We've had more success earlier. We're starting to see some more folks come into our offices now. Mostly folks who are either looking for what we call adult Medicaid, trying to get their family member eligible for some of the nursing facility care type of pieces. Those are the most complicated eligibility pieces to figure out. And folks who English is a second language, because then our systems, while they can work online and on the phone, folks feel much more comfortable coming in. So this is, again, just to show you how many we serve, who we serve. Childcare is a big component here. And I think through the pandemic, what I think became evident, and through the last budget session, it's really the first time we put state general fund money into childcare. But it's a big piece of getting people back to work. If you don't have childcare, it's difficult to go to work. So identifying that as a workforce support, I think, has been really critical. And I think we've all come together to realize that as we go down the past couple of years. So I'm excited about that. The Benefits Cliff Task Force that met really identified childcare as the biggest cliff, because you're eligible or you're not. And when you lose childcare, those of you who have purchased childcare on the private side know that that can be very expensive. So if you lose that support, what can happen then is you may fall out of the workplace. You're trying to make a decision about, is it worth going to work and pay however much you would pay, looks like tuition, for childcare. So that's been a discussion. Representative Heffron, thank you for your bill. I think with House Bill 499, we are on track for implementing, but it's an acknowledgement that we need to support our employers and look at a benefits cliff and support folks who need that additional support once they get a better living wage job. So thank you for that. My favorite piece of legislation last time. Moving on to the next slide. I have behavioral health in here just because behavioral health crosses so many borders. And even though it's not necessarily a charge here, I think as we talk about children and families, their behavioral health support, we know, is something that we're going to need to look at going into the future. The number of kids that come into kids that come into care because their parents have substance use issues is tremendous. We've seen grandparents raising kids, the fatalities from fentanyl overdose, which then again can bring kids into our care. It's something that I want to acknowledge as we go through this. Again, that I know it's not necessarily directly in the jurisdiction here, but I need to acknowledge that we've all seen the impacts and the need for additional behavioral health supports, substance use supports. I actually serve on the opioid abatement task force with the Attorney General's office, and so again, we're all trying to look at this. This is not any kind of partisan issue. We all know that the substance use issues across the Commonwealth are tremendous and a big challenge. Now on to the Department for Aging and Independent Living. Again, this is one of the reasons I think it's very exciting that we have this committee. Not only do they serve folks who are aging and our aging populations through many different programs, one being the Senior Meals Program, again, which I addressed. We've served over almost 3 million meals. We used to have a waiting list. We do not anymore. Again, there was some funding provided by the General Assembly in the last budget, which is great. I mean, I don't believe, and I don't believe anyone thinks that we should have seniors who are in their homes who are hungry and that we can't serve. So we've been able to serve. A lot of times that's a touch point for socialization. I tried to deliver meals when I was with the city of Louisville, but I ended up talking too much to the seniors, and they said I wasn't a good deliverer. So these are important pieces for those folks that we serve. Counties, it's a local, the area development districts, I think they had a breakfast this morning. The area development districts have the aging programs within their purview and working on the local level. And so there's a lot of creativity that occurs within this program. Another big program within Aging and Independent Living is the guardianship program. Many times, someone who can't take care of their own finances or take care of themselves can be assigned by the court to the guardianship program. The previous administration sought Medicaid participation on the healthcare side. It has brought more funding into the guardianship program and helped us reduce some of our caseloads, and we continue to work on that. That is a piece that there's always this, there's always this balance between like what the courts, when they can't they'll really don't want to find somebody guilty of a crime, but they realize that they can't take care of themselves, and oftentimes we end up in guardianship with some of those folks. So it's a relief valve for a lot. There's been a lot more focus on guardianship, more on the private guardianship side than the public guardianship side, but it's a program that I do believe helps people, and we do that all within the Cabinet for Health and Family Services. Then there are many other, the aging and independent living. So the independent living piece are folks with disabilities that are served through also this department. Again, Medicaid plays a big part, but there are programs called heart-supported living. Some of you will recognize that. That's an older program, a general fund program that serves people with disabilities and can pay for things that other programs don't pay for, home improvements and things like that. There's a personal care assistance program. So there's some other programs there that, again, get no or very, very little attention within this department that I think would be great to have a more full discussion about. Victoria Elridge is here somewhere. There she is, who is the Commissioner for the Aging and Independent Living. And I'm sorry, I should have also mentioned Stephanie Craycraft, who is our Acting Commissioner of Behavioral Health, and Lisa Dennis, also our Acting Commissioner of Department for Community-Based Services, are with us today. And they will answer questions when I get in trouble. Next slide. Wow, we shouldn't have this one, but this is the Commission for Children with Special Healthcare Needs, probably another jurisdiction. The one that we should have had here, sorry about that, is the child support enforcement and disability determinations. Again, both of those are a subject of the reorganization bill that Senator Meredith will be introducing. Child support enforcement sits with the cabinet. It has an old system that we need to upgrade. The back end of the unemployment insurance system is the child support enforcement system. Blue screen, DOS. I know what DOS is, but again, nobody younger than me does. That's it. We do have we are in the process of updating that system. There have been concerns expressed frankly, on arrearages with our county attorneys and what we may need to do with that. I think that's the impetus of the reorganization bill, which would then, I think, at some point move this program to the Attorney General's office. The disability determinations, we're a contractor for the Social Security Administration. Those disability claims, we process those. We're actually one of the best in the country, definitely the best in this region, in terms of our timeliness and our processing. That's a program that actually works very well. But again, there's a lot of controversy around it. That Eric Kahn, the attorney, where a lot of folks lost their disability, and it got and people really were hurt by that. That is still rolling through our systems years later. But I think most of those have been adjudicated at this point. But that's part of what the cabinet does as well. And I don't believe I have ever given a long presentation on the Disability Determinations Office and what they do. And it's kind of a shame because they do things very, very well. Another office is our Office of Inspector General. The reason we put this here is this is our arm that does what we call special investigations. They're also the arm that actually licenses child care. So they're the ones that actually go out and license all of healthcare, but they have child care within the Office of the Inspector General. So that's basically making sure that they comply with regulations. They're the folks that do all of the investigations on our basically our child caring. So those are the facilities where some of the children in DCPS get placed when we can't find foster placement or have significant needs that necessitate that. Next slide. So Family Resource and Youth Services Centers, everybody's favorite. Also in the reorg bill, I've testified that I want to keep them because they're my only good news in the cabinet. That and Serve Kentucky. But a joke that I've been over a lot of these programs in the cabinet because I've been there so long. I referred to myself as the utility infielder. I've at times been over the Inspector General's office, the Family Resource Centers, Commission for Children with Special Health Care Needs, Communications Ombudsman, Behavioral Health. So when there's been an enacting role, like just introduced, when it's been a temporary sort of thing, I've done a lot in these programs. I was over Family Resource Centers about 1 million years ago. But a great program designed to address non-academic barriers to children's learning in schools. The reason that it's in the cabinet was when the Kentucky Education Reform Act, those of you who remember that, in 1990 was passed. This is probably the most, I like to think, this is the most successful piece of that. And it was placed in the cabinet because many of the programs that address those non-academic barriers to children's learning are programs that are within the cabinet. You're talking about hunger and clothes and behavioral health and those kinds of programs that are within the cabinet. It's why this program is here. It's really a nice connection between the Cabinet for Health and Family Services and Department of Education. It brings together so that we actually can talk about how are we impacting children's learning with some of the programs that we provide. So I'm a big fan of Family Resource Centers and would love for them to stay. And then Serve Kentucky. This is a volunteerism program. This is the AmeriCorps program. They are all over the state. They've responded to some of the disasters that we've had. They have a really kind of a disaster corps, so they sit with the Emergency Operations Center and bring volunteers into areas that need help. They also do other things. They work with our Family Resource Centers. It's a way for folks to get to employment. So I think the reorganization bill contemplates moving them to education workforce development. Certainly they reside there in a few other states. But again, most of the programs that support these individuals reside within the cabinet. We have benefited from their participation within the cabinet. Most states have them in more of the organizations that we have. One more slide. Is that right? Oh, we're done. Okay. So two things. Kentucky has The Cabinet for Health and Family Services is a relatively unique structure within state governments. Looking across the country, there are probably 15 cabinets that are organized like this one across the Commonwealth. It's what I call a monster cabinet, because when you have all of these programs, particularly when you have Medicaid and DCBS together, it gives you such a broad scope, so many employees. I've been around a long time. When Governor Patton split the cabinet into families and children in the name of this committee and health services, I didn't think it worked particularly well because even it just started, I like to call it was like sharks and jets, right? We broke off into our teams and we didn't necessarily work well together. And so Governor Fletcher, when he came in, put it back together, which I was very happy about. So I think it works better together, just so you know, because these programs, when you look at behavioral health, when you look at physical health, when you look at what happens and how children get into our systems, and that kind of support and comprehensive support that we hope we provide within the community, going across these kinds of programs, I think it makes sense. So, like I said, there are about 15 other states that do it this way. And then there are about 13 states, so we're also called a statewide agency. And the reason we're a statewide agency is the big states, California, Florida, Texas, Ohio, New York, and a few others, they basically run these programs through their counties because their counties are so big. So there are a few states that do it that way. We're a statewide organization. And we have what we call an integrated eligibility system, which again, if you split a cabinet apart, which was one of the discussions, you lose that ability for somebody to just come in and look for services and kind of get the whole array. Again, I think it works better together. I've lived through both of them, of being pulled back apart and put back together, and I like together. It seems to work better. So that's my brief as I can do, overview. And so thank you for the opportunity, and I look forward to working with any of you. My door's always open. I know folks say that, but you can text me, you can email me. I'm open to that and happy to sit down with any one of you if you have specific questions or want to go in more in depth one-on-one. I'm very happy to do that and would welcome that opportunity.
Okay, we'll have questions. Representative Banta.
I just want to clarify, and it may be because it's really early and I missed it. You're upset that we split this committee?
No, I'm very happy that you split the committee because these are the programs that get overlooked sometimes in a combined committee.
Okay.
I didn't like splitting the cabinet.
Okay.
But
I got lost there.
Okay, I'm sorry.
I'm back.
Sorry. Okay.
Thank you.
All right, Vice Chair Rowley.
Thank you, Secretary Freelander, for your presentation. I just want to ask one simple question, just to get a number. So to get Medicaid 138% above the poverty level, how much is that amount?
It varies by family size. What's the one?
It's about maybe $17,000 or $18,000 a year for a single individual.
Okay. And you would double that for family? How do you do? You double, triple, quadruple, depending on
It isn't doubled. It's
Make sure to turn
incremental.
your microphone on, please.
I'm sorry, it's not doubled, and so for a family size of 2, it's around $21,000 a year or so, but it's not doubled. But
Okay.
certainly we can share those income limits with you.
Okay, thank you so much.
Representative Raymond.
Yes, thank you. I want to ask about childcare, of course. It's a funny thing, where childcare lives in the Cabinet for Health and Family Services. Of course, it really relates to health, lifelong generational health outcomes. Of course, it relates to family services in that childcare supports the whole family. We know also that high quality childcare is education. But I wanted to ask, we know that, so there's 2,000 centers or so right now. We know that there used to be 3,000 or 4,000 like 10 years ago. So we've lost more than 1,000. People are going, okay. We've lost a whole bunch of centers.
We've lost a whole bunch of
in
centers.
the in the last decade.
Yes.
And it's really just ARPA dollars that have ensured the survival of a lot of our centers in the last couple of years. And I'm worried later this year when those ARPA dollars run out, stabilization payments and other benefits that centers have been able to receive to stay open and continue to receive our kids. So I can be here this morning. I think if we lose more centers when we lose those ARPA dollars, it undermines the success of House Bill 499. And so I'm wondering what you think needs to happen.
So, yes, that's of concern. When I talked to the Benefits Cliff Task Force, I'm worried about that. Now, here's what's going to happen, because like in September-ish, some of the ARPA dollars will go away. We have enough funding to continue some of the pieces that we're doing. Those pieces have to do with we're paying for enrollment rather than attendance, which is a big change. We are paying for copays, which oftentimes providers find that copays are what they call copays no pays, right? They won't kick somebody out for the copay, but so then they just don't collect it. So we're paying copays for folks. We've changed a little bit of and it's minor, the income threshold for folks who are eligible for some child care assistance. It was minor. So some of those kinds of payments for providers, we will be able to continue to get to the next budget cycle, right? So that's not a cliff, but the sustainability payments have been huge, and those are the ones that are going to be more difficult to continue. To give you a sense of scale, looking at what we'd be asking for in a budget request in the next budget to continue the piece that I said we're going to try to continue, that's around $100 million, so it's not a small ask. The sustainability payments are double that. They're like $200 million. So that has also been what has helped keep centers going. I've talked to some folks on the Pritchard Committee. I think they understand that that's kind of what we're looking at. So you are correct. It's going to be a challenge. We're committed to keep as much going as we can so that we can get to the next budget, to keep as many centers healthy as possible. But the sustainability payments, and they really were supposed to be temporary payments to support folks during COVID. When they go away, that's going to have an impact.
May I ask a quick follow-up?
Yes.
Does the legislature need to codify some of these changes, like the increased income eligibility threshold for CCAP? And will the cabinet be asking us in the next budget cycle for $200 million to invest in our child care centers?
So in all likelihood, we'll be asking for 100, right? But I don't. Then I'm asking for 300 million. That's just a gigantic ask. So I think
Not too much for our kids.
not well. I agree, but it is a gigantic ask, and so even 100 million is a massive ask. So I can't commit, right? But if this is Eric being in state government for 100,000 years, I think we'll probably ask for the 100, and then see what's possible within the budget for the next cycle.
And do we need to codify those other things?
Oh, the other changes. So those are in regulations. Those, right? We have changed the regulations for that? Yes. Okay, very good. So they have been codified within the regulatory structure. So I think you all will be receiving regulations as they go through. So that's always, we'll make the proposals that come through regulations. There's always the opportunity for back and forth in that process. So, and those have gone through. So they are codified at this point.
Representative Decker?
Thank you, Madam Chairman, and thank you for your presentation today. I was thinking, as I was listening to you and all the different things the Cabinet does, about all the roles I have had that have put me in contact with your agency as an attorney, as a director of a homeless shelter, as a member of a site-based decision-making council, so with your Friskies, as a field representative for U.S. Senator, and as a legislator. And every single contact, many times it's been just dire situations, I have found professional people in your cabinet with a heart for the people they serve, with a passion for service, you all deal with human need every day from, I mean, I can't imagine your telephone. You care about people. You've dedicated your professional careers to that. I appreciate that
Thank you.
greatly. I appreciate all the help that you have provided when I have contacted your department. And so the one thing I've noticed of all the contacts where there might be a weak link is in the funding for child protective services. They're overworked, they're understaffed. And so in thinking about that, I wonder if you could comment. I run an organization. I know that I have to look at my budget and think, is there something I could move from one division to another? Is there something I could cut? Or do I just need new funding? So if we were to, and I may be wrong about my perception, but everyone I've talked to in Child Protective Services has been compassionate and caring and wanting to solve every problem and respond to every need. But they are stretched so thin that sometimes it's not possible, and so it looks like they're not doing their job when I think they are. They just can't fit it all in. So can you comment on moving, cutting, or new money?
Sure.
And if my perception is correct.
Your perception's correct. But first I want to get back to where you started, if I may. One thing I do like to say all the time, the folks who work in Child Protective Services, the folks who work for the Department of Community-Based Services, I like to refer to them as everyday heroes. They are out going, families that have significant issues. They go into issues where times in homes where there's domestic violence, which oftentimes law enforcement is worried about going. That's probably the most dangerous situation you can. Or you're going in for a child removal. That is dangerous. And these are folks who go into these situations. They have protocols. You don't let anybody sit between you and the door. I mean, there's all sorts of things. You make sure your car's pointed out of the driveway. There are things that our workers have to think about every day. And it is, we have a recent, probably last year, where a social worker had a gun held to their head. And so we've made some progress. The General Assembly did provide additional funding. The challenges have been how we articulate and get people to take these positions. Our caseloads have crept up over the last year as we've seen more reports of abuse and neglect as we investigate. That's a true statement. Our staff is stretched too thin. What we need to do, I think, and what we're trying to do is, one, change perception of what that role is. You're right, you have to have the heart to do that. As we work with our colleges and universities, sometimes what the professors in those programs say is, okay, the last place on earth that you want to work is DCBS. And so we have to change that perception and that narrative. That's going to take some time. We are working on it. But you know, if your professor says you don't want to work there, well, guess what place you're not going to work? As every place has seen post-COVID, trying to get folks into jobs and the competition around social workers and those who are qualified to be social workers, not quite as intense as nurses, but still pretty intense. So we had to raise, and are raising, and have raised, minimum salaries and entry salaries as much as we can. Probably our last bit of that was in January. We're seeing some help there, but we've got a long way to go. So at this point, believe it or not, I'm not going to sit here and tell you that it's a funding issue. It is a job attraction issue. And so we've got work to do there. I hope folks like you, folks in the General Assembly, as we recognize these social workers as being heroes and knowing that their heart is good, that's going to be so very important. You know, a lot of times social workers make the right decision 98% of the time. And then those 2%, and I guess you all can know, working with, in our age of media. It's much more readable, consumable when you can point to the disaster, right? And we have them. We do. It does happen. It's foolish to say it doesn't. We've had children because of their severity who've been in our offices because we can't find placement. Some of that relates to capacity, right? But that happens. So what I hope I'm trying to do is support conceptually, support financially, and the reason I came back to the cabinet, I was working for the city of Louisville and having a great time working on homeless services, and I just loved it. Because there are things that we can do to make a difference. But I realized we hadn't addressed the secondary trauma that our social workers have. We now have some traumatic leave time, just got through, that we've been asking for a long time, and I think it's going to make a difference. So we've got to make our workplace environment as attractive as possible. We have to support our social workers as much as possible. And at this point, I can't tell you it's funding. It is how do we attract people into the positions.
Thank you. Thank you for that answer.
Representative Fleming.
Thank you, Madam Chair. I appreciate that. Just going back to the earlier comment, Mr. Secretary, some of us has been up since 5 a.m. and trying to get things together and listening and so forth, but the person's over there not paying attention. But anyway, I just want to follow up on. I know it. Sorry, I had to poke you because I'm the same way. I just want to follow up on Representative Decker's comments, and that's what I want to sort of focus on. And I've had some correspondence with Child Protective Services throughout the state, and that's rather concerning. Hearing the statistics, the intake volumes that come through, and just sit there and put kids in a very vulnerable, harsh situation and so forth. And I appreciate your comments because I know you're passionate about what you do and you're highly respected, I think, in this General Assembly. And I wanted to just get a little more in detail. If you can provide, what is your action plan? You said you got a cultural change, and cultural change, I've been through that with my own company as well as working for a company a long time ago. That takes a couple of years.
Yes, it does.
You talked about funding. Yeah, we can do that. We can look at the funding. That's going to happen until we get together next spring. So I just want to see if you can comment on what in particular do we need to do, either from a legislative standpoint or a messaging standpoint to get folks attracted to this position. Because I have one person who's like, he said they don't have anybody else in their department because of various reasons. So if you could just give a little more details, a little more hard strategy that you might be able to let us know from a legislative standpoint or from an operational standpoint.
I will always promise to be direct when I testify. It's going to be hard to do a quick fix. And we've had 20 years of declining social worker roles. What I'll tell you is here's what we've done, right? We have worked on, you're right, culture. There are some folks that say real culture change within an organization takes 7 years. I'm hoping that's not the case. We don't have 7 years. But that doesn't mean you don't work on it. So we do work on it. We have increased wages. We've increased our entry level wage several times, and now we're as basically within the personnel system. We're about as high as we can go.
No, I don't really know what you.
Yeah.
Let me ask you, because I wrote down a note here, and is the personnel classification structure a problem in your cabinet?
I don't think it's as big a problem. I don't think it's as big a problem as the cabinet over the years, and I've been there, right? So part of it, I've been there and watched it. We've nickeled and dimed ourselves, so that when we had the opportunity of raising entry-level salaries, we didn't take it, and we got so far behind.
Mm-hmm.
And so by raising folks to basically what we're calling the 90% of midpoint, so I can give you kind of a real specific thing that we've done.
Yep.
For some folks, that was like a 20% increase. But why did we let it get that bad, right? I can't answer that question. There's some funding issues over the years, absolutely. But that's not where we are now. And one of the hardest things it's been for me to turn around within the cabinet is we've always had this kind of poverty mentality in the cabinet, right? We've always had that. And the General Assembly in the last budget really gave us a very strong appropriation, right? But it's been hard for us to figure out and adjust to, hey, we actually have the money to be able to do this. So getting us all there has taken some time. It's a culture change, right? We did raise social worker salaries, but we were at that point so far behind, it didn't have the impact that we were hoping. What I'll tell you now is, and I do think this is good news, we're not losing anymore. If you look at the number of social workers, we're not actually losing anymore. We're holding even or maybe just starting to climb. In this last fall, since 2018, for the first time at the cabinet, we didn't actually lose employees. We maintained. We went up in a 7,000 person cabinet, a couple of positions. But we hadn't done that month over month for a period of 2 or 3 months in a row since 2018. So our fall has been going on a long time. I believe we reached the bottom last summer, and so we are slowly making our way back up. People retire in August and December, so we had a couple of hits in those 2 months, true, but you see that all the time. I think we are on the path to get back, but that's going to take time. I'll be happy to share with you. We're doing some social media pieces. If you listen to National Public Radio or some of the radio programs, iHeart, I think we're on iHeart as well, where we're actually trying to get the word out that we have open positions, right? That folks can come in and work for the cabinet, and it is not, it is some place to come work. So so media campaign, working on culture, working on salary. Honestly, we're trying everything. Working with the social work schools, we're trying everything. I think we're having some impact, but again, we'll have to see over this next year.
Quick follow-up, Madam Chair.
Quickly.
Thank you. Has there been any consideration given, I guess, the personnel challenges and the backlogs and investigations to work with like a nonprofit organization on a contractual basis, no matter if it's a year or 2 years or whatever, to help go through that process to address the backlog and those issues?
We've done a little bit of that to get some help in closing cases and working through some things, primarily in Jefferson County, where probably the need is the greatest. Yep. So we have done some of that. Okay. The other piece that we're trying to do with nonprofit organizations is get them used to our Connect website, so that they can, because now you can start to work on some of the eligibility pieces and some like SNAP and TANF and childcare. We view those as some prevention programs as well. So working with the nonprofits to shore up some of that, because if you call our phone lines now, you're going to wait for 45 minutes. It's atrocious. We've worked on that. We're still working on that. And trying to hire more people. We've been probably more successful in hiring on that side than the social work side. I think that's a true statement. But we continue to work on that. So yes, we've done some of that. Could we do more? We can certainly look at it. We're trying to relieve the pressure on our workers as much as possible. It is a tremendously challenging, as you all have pointed out, tremendously challenging position within the cabinet.
Okay.
But what I say to folks, basically people who work in the cabinet, particularly those in DCBS, which is where I try to get back to the heart of things, right? Some of us are given the grace to be able to wake up every day and perhaps make a difference in someone's life. And that's what the social workers and folks in DCBS get to do every day. And that's a privilege, right? But that's not a message that they hear or have heard in the media in particular. Love my media friends, but that's not the message that they hear. So that's the message I have to give. You all have said it so well today, so I appreciate you all saying that and being supportive.
Well, thank you and your team.
All right, we have 2 more questions, and then we are going to wrap up. Representative Dietz.
Thank you. Good morning. I, too, my background is as an attorney and all in family law for the last 30 years. So early on in my career, I volunteered as a guardian ad litem. The fee then was $250, so I say volunteer. That was our max. So I see a big difference now in the number of dependency, neglect, and abuse cases from 30 years ago when I started my career. But what I also see now, though, are we have social workers that spend all day in court.
Yes.
So I'm wondering how much could the court system, are we not using our court system and family court effectively and keeping children in care for too long, or are our judges just pushing them down where we've got social workers keeping these cases open so long so that they have too many cases, if that makes sense in what I'm asking? And what can we do in family court either to help reduce that caseload by moving the cases through more quickly?
Great question. We do work with the administrative office of the courts. We do try to work with the judges. Actually, Representative Fleming, it actually gets back to your question. Social workers go into court, and it's not something you think about that that's what social workers do, but they spend a lot of time in court. They've never been in court before. They don't have representation, and if they've made a judge angry, or the system of seeing some of the same people over and over again, judges can get tired of it. And when we asked social workers why they left, the second highest reason was court. So we're actually starting a pilot, again, back to specifics, of making sure we have an attorney from the cabinet, and this is just a couple of counties, who will be in court with the social worker. They don't have an advocate. Again, as I say, the 18-year-old, right? And the public folks who do help, but they're not there for the social worker. So we're going to try in a couple of counties to see if that helps, and it's another way to try to make the job more tolerable. But yes, to everything that you said, we do try to work with the courts. It's really interesting because some of now the teledockets have been helpful. It's been more helpful on the behavioral health side. But we always work with them and work with what's that called? The College of Judges, to really talk about what it is that our responsibilities are within the system and hope that we get understanding through that system. Is that helpful? Okay.
And the last question is Representative Rourke's.
Thank you, Chair. So I had the opportunity to work with Secretary Freelander in Louisville for encampment services for homelessness, and also had the opportunity to witness AOT and how that program and our social workers are able to respond with a variety of wraparound services, and how that truly does over time help stabilize our youth. And so have definitely seen the impact of social workers having because of their presence in court, and really appreciate those services when we're able to see movement. So my one question as a follow-up to the others that have been said was, what is the staffing deficit currently in terms of vacant positions within the cabinet, and which areas have the highest rates of vacancies?
So the three areas that concern me, two in DCBS, family support, social workers, right? And that deficit's about 500 together. Okay, those are the two of the three that I'm most concerned about. The third is the Office of Inspector General, because in order to do surveys, you have to have nurses, and so as hard as it is to get social workers, it is that hard to get nurses, even more difficult. And so a lot of times you have to have healthcare specialists who serve as the inspectors. So those three places, and I think we're down, I want to say 70 the last time I checked, which, you know, in a department of maybe 200 employees, that's a huge number. So we've got real challenges there. We've also tried to increase the midpoint and those kinds of things, but we're not even close, right, to nurses' salaries. So that's the other place that I am very concerned, because we're slow. We're probably going to get something in, you know, a Newsweek article that we're one of the slowest in the country. But it's because we have the personnel deficits. Now, we're still doing all the citations, and we're still, you know, we go out on complaints and all of that stuff. But I'm very concerned about that.
Thank you. The next item, thank you all very much.
Thank you so
we
much for
greatly
the
appreciate
opportunity.
it. We look forward to your all's continued partnership. You do have items received for review. Each of the committee members, these block grants are the status reports that are required to be sent to our jurisdictional committee each year. Later this year, when the grants are up for reauthorization, we will have a hearing on them. Today, they're just made available for informational purposes. There are 4 different grants that you will have in your packets. I do want to make a note before we adjourn. Our lead staffer for the committee is Ben Payne. Our committee analyst is Samir Nasser, and the committee assistant is DJ Burns. As everyone in this room knows, we do not have a committee unless we have great staff, and we have great staff. So we greatly appreciate the opportunity to serve with each of these gentlemen. Our next scheduled meeting of the House Standing Committee on Families and Children is on February 16th, 2023 at 8 a.m. in Capitol Annex Room 171. Our first meeting is adjourned.